These lawmakers and the media and how they're finessing the public around the world, not just here in America, about this whole COVID nonsense, the struggle. Let's get into it. But before we get into it, if you are new to the channel, I want to say welcome. This is Bruce the Boss Brooks. Please smash on that subscribe button and hit the little notification bell so you can get notified of my latest content. It goes a long way with helping channels like this and voices like this get heard and get moved up in an algorithm that is purposefully trying to suppress it. And if you are not new to this channel, I want to say welcome back. Thank you. And don't forget to hit that like button. And also don't forget to comment below. I want to hear your thoughts and interact and share this video. Let's get into the conversation now. So I'm actually going to break this video up into two parts. So if you saw the thumbnail, yes, I do want to talk about Andrew Cuomo and his International Emmy Award for his fight against COVID, but I'll do that in the second half. First, I want to talk about these lockdowns and the hypocrisy being expressed and or exposed by these lawmakers and politicians. So just as I predicted, shortly after what was transpiring in Europe, and definitely after what appears to be the media calling the election for Joe Biden and VP Kamala Harris, most of the nation here in the United States are starting to put their citizens under stricter lockdowns, stricter than what we saw before. But it's now being revealed in a court that a lot of these lawmakers that are initiating these lockdowns in these various states are actually getting caught being hypocrites and doing the very thing that they're telling their own citizens they cannot do themselves. The most recent and infamous example is California's Governor Gavin Newsom being caught at a dinner party with public health officials in the state of California where there's no masks, no social distancing. Yes, they at one point they were eating, and it's not reasonable to expect you to eat with your mask on, but there are also photos of them walking around, standing, not wearing a mask, but also why are they shoulder to shoulder, arm, elbow to elbow at a table anyway? Then you have Mayor Jim Kenney of Philadelphia getting caught eating at a restaurant and having a few drinks just one day away from him announcing to the city of Philadelphia, I'm going to close indoor dining for your safety. Or how about the infamous example back in September with Nancy Pelosi getting caught red-handed trying to get her hair done at a salon with no mask. Mind you, at this point in time in San Francisco, salons were technically supposed to be closed. And yet here she is trying to get herself taken care of against the own rules of her own city and district, and all the while not even wearing a mask the whole time. Or how about Fredo, aka Chris Cuomo of CNN, testing positive to the coronavirus early during the pandemic, and while he's putting on the show of how he's bunkering down and quarantining himself in the basement of his home or condo, whatever it was, and not coming out at all until the recommended 2 weeks were over. And yet prior to his famous "I'm coming out of the basement" montage that was all fake, days earlier he was caught in the Hamptons by a resident cycling in the area, saw Cuomo out and about overseeing a construction site with no mask, and confronted him. That just goes to show what they really knew about this virus and the level of threat and or safety it really posed on the general healthy population. I'm not even going to say that it's hypocrisy. Rather, I think these are purposefully done. They know exactly what they're doing, and that is that these public health officials and or lawmakers are finessing the world in regards to the seriousness of this COVID-19 virus. They know that a lot of these restrictions that they're imposing on you are not necessary and don't even necessarily work and or are effective, and yet they're doing them anyway. One, because they get more power themselves and they can control the narrative, and then their million and billionaire friends are making money hands over fist during these lockdowns and pandemics. I mean, even with Governor Newsom, he's at a dinner table with public health officials. These are supposedly doctors and or scientists in this field, and there is zero social distancing, zero masks being done. And if they knew better, especially being public health officials, they would have acted better. It's not that they got caught slipping, do as I say, not as I do, oops, my bad. They know the truth, and the truth is that the COVID-19 virus is real. I do want to emphasize this. It is real. It is not a hoax. But the narrative being framed and or being pushed to excuse these excessive authoritative orders has been over exaggerated. This virus is not like the Spanish flu, like it was initially reported to be. This is a virus that is very discriminate, because the Spanish flu was indiscriminate. Didn't matter your age, your health condition. It attacked you with a vengeance and killed millions, tens of millions around the world. Whereas the COVID-19 virus seems to be very discriminate, with the average age of death, if I'm not mistaken, and correct me if I'm wrong in the comments, the average age of death is somewhere around 71 to 73 years of age, if not higher than that. They keep talking about rising cases, and yes, and I believe it's a fact that 75% of all of these so-called positive test cases are people under the age of 40, and yet over 80% of all of the deaths are people over the age of 65. It's also a fact that these hospitals are not getting overwhelmed or overrun, because even during the height of the pandemic here in the United States, you had several TikTok videos of doctors and nurses, orderlies, performing choreographed and coordinated dance videos. You also knew it was a fact that a lot of these hospital staff, nurses, doctors were getting either furloughed or having their hours severely cut because there was no work to do. New York City was pushed to the limit. Parts of northern New Jersey, like Jersey City, New Jersey, yes, that's the name of an actual city in northern New Jersey. Yes, they may have been getting overwhelmed, but then you have Syracuse, New York, during the whole time had over 300 hospital beds free, and that was actually quite representative of the rest of the country. Even in California, Georgia, Florida, hospitals were, one, not overwhelmed, and the majority of these test positive cases are just people being tested and then testing positive, not showing either any symptoms or at worst showing such mild symptoms that they're able to kick in just a few days, if not a week. If anything, a lot of them think that they have the allergies because the symptoms are so mild. Even right now with California, because I wanted to run the numbers once I heard about their lockdowns, yes, they've tested since the start of November over 102,175 positive cases in between November the 1st and November the 16th, for instance. However, only 4,500 hospital beds are being occupied by coronavirus cases. That's 4,500 out of 74,000 hospital beds throughout the whole state of California. That's not even 6% of all hospital beds. And 4,500 hospital beds out of over 102,000 test positive show this is not as serious as what they're saying it should be. The data has been clear from the very beginning of this, although we have several months of data now to go off of, that the elderly are many, many, many times more vulnerable to a more serious outcome than the young. And so what I'm saying is that it was necessary, therefore, for the governments of the world to work out a strategic age-based strategy and start aggressively protecting and isolating the elderly and those with pre-existing conditions, all the while informing the rest of the general population who is not at serious risk of either catching symptoms or developing any kind of moderate symptoms, just advising them on the risks and the precautions and what they need to do, much like what is being done in Sweden to this day without any catastrophic results. It's not possible for the government to provide a completely risk-free society or prevent every possible event that could possibly cause harm. Risk regulations that are extremely costly and not properly targeted will only divert resources and attention from the areas that really need it, from those who really need it, i.e. the elderly and or those with serious pre-existing conditions. Instead of updating their strategy, which simply just seems to be lockdown, 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 which is not a plan or a strategy, but just a diversionary tactic and or a stalling tactic, they seem to be basing this off of what we knew or didn't know back in January and February of 2020. Whereas that was all based upon epidemiologist studies that greatly exaggerated the risk of the virus and calculated the death rate to be around 3 and 5%, when in reality, according to the CDC's own numbers, it's closer to 0.1%. 0.1, i.e. a 99.9999 survival rate for those under, let me correct myself, 99.9999% survival rate for those under the age of 20, 99.999% survival rate for those under the age of 50. So survival rate of 0.0001% for the majority of the population. These politicians, these lawmakers, and a lot of these health officials know this, and yet they're still pushing these draconian and dystopian and authoritative orders out there. Again, why? To concentrate more power in their office, as well as get more money for those who are rich, because you're destroying economies, it's destroying businesses, and a lot of those who are multimillionaires and or billionaires are buying up these smaller businesses that are going under, and they're making money hand over fist. And I think the public really needs to be outraged at these public officials who are flaunting the fact that they are going against their own public orders and their actions. They are locking people down, all the while doing the exact opposite, because I really believe they are finessing the public. They know that it is not as great of a risk to the general population as it is to specific individuals. But rather than creating policies that, instead of destroying entire economies and people's way of life, they are doing a one-size-fits-all to destroy the economy, job market, and or the way we deal with each other in order to initiate their planned Great Reset. So I really feel as though people really need to start calling these politicians out, stand up and resist a lot of these unnecessary, mundane orders. But that's all I had on the so-called government hypocrisy that I really feel as though is government finessing the population. Now let's get into Governor Cuomo. So apparently I got word that he is the winner of some International Emmy award for how he handled the coronavirus, an award that mostly has always historically gone to, at least within the last 20 years, fictional politicians like Frank Underwood of the Netflix original series House of Cards. But this time they decided to give it to a real politician, and decided the way Andrew Cuomo dealt with the virus was the face of the nation, if not the Democratic Party, in the struggle against the coronavirus, doing daily news briefings and upping his approval rate. But is this really well deserved? Because if I'm not mistaken, New York State had the worst response and or handling of the coronavirus. If you took New York out of the equation, the United States numbers on the coronavirus would be significantly much better. I mean, for that matter, take out New Jersey as well. But New York, in a state with a population of only 19.4 million people, had a total of 33,000 deaths to the coronavirus. Don't get me started on how I feel as though these numbers are inflated. I've talked about that in previous videos. You can go check them out. Feel free to look into my history on that. But let's take that number for what it is. They've recorded 33,000 deaths in a state of only 19.4 million. Whereas Florida, in a state with more people and a larger elderly population, because we all know Florida is famous as being the state for the snowbirds who, after they retire and or hit a certain age and they live up north, they usually retire down south and or move down to a home in Florida to retire and or move during the rough winter times of the north. So higher elderly population at that, which is more vulnerable, and that state has 21 million people, and yet have only recorded about 18,000 deaths to coronavirus. That is a good 15,000 less than New York State, despite having 2 million more people and a higher elderly population. And then there's my home state of Texas, much bigger in every sense of the word, land mass and or population. Texas's population is 29.5 million people, because New York City is really just New York State is really just New York City, which has over 8 million people, and then the rest is throughout the rest of the state. Whereas Texas has a Houston, which is not too far behind New York and rapidly growing in population. We have San Antonio, we have Austin, we have Dallas-Fort Worth. So we have major cities. But bottom line, much bigger state, 10 million more people, and yet has only recorded about 17,000 deaths of coronavirus. And that is mostly recent, because earlier during the pandemic, as recent as the end of the summer in August, Texas technically had around 7,000 deaths. So at some point there was a big jump over the course of the summer. But we also relaxed the rules, opened things up more. People were doing more things. But still, 17,000 is still half that of New York State's numbers. And so how are all of these states that are doing much better than New York State with more people, and yet they're getting shafted? And let's not even talk about Andrew Cuomo's executive order to put COVID positive patients into nursing homes. I repeat, there was an executive order from Andrew Cuomo to put those who tested positive for the coronavirus into nursing homes. That is the most at-risk community. And how is that not a controversy? And how does he win this award despite that, which I believe made up over 46%, if not a little bit more, of all of the COVID deaths? So you can attribute half of that 33,000 deaths directly to his order to put the COVID-19 patients into nursing homes. Is it really just all about the image and doing press conferences? Is there really that much of a liberal bias that you could not possibly give this award to someone more deserving? It's funny how the media and or those in society, the culture, can try to shape narratives and want to paint someone like Andrew Cuomo as the hero, despite the fact that he has an executive order that helped lead to a big outbreak in the nursing homes and accounted for over 46% of all of the deaths, and having more deaths than the other states that I mentioned, led by Republican governors, DeSantis and Governor Greg Abbott of Florida and Texas, respectively. And yet they get the shaft and Andrew Cuomo gets the reward. That's really biased. So that's my video. I want to know your thoughts. Leave your thoughts in the comment section. Again, if you agree with any of my points, please don't forget the like button, share this video, and if you're new to the channel, don't forget to subscribe to this video. This is Bruce the Boss Brooks, and I'm out.